Meantime, 3 children have died from the Omicron variant over the past week, according to the state health department. That brings the total of pediatric deaths to 21 since the start of the pandemic.
And as Caitlin Rust reports, this comes despite our cases and hospitalizations continuing to drop.
A little bit more. As it keeps going down with the mandates, I feel a little better.
Some parents take comfort in the drop in our COVID numbers, while others are still on guard.
I'm very happy that the numbers are going down, but I'm still, concerned because a lot of people don't have the shots and they refuse to wear the mask.
New Orleans Public Schools announced this week their positivity rate sits below 1%, down more than 0.5% from the week before. Children's Hospital New Orleans also reports a hopeful drop. Just 2 children hospitalized Tuesday, down from as many as 30 earlier in the year, and a testing positivity rate of just 5%, down from as high as 30% at the start of the year.
There's much less community transmission occurring than there was just a few weeks ago.
But Dr. Mark Kline at Children's says Omicron has not been as mild as we had hoped it would be. The Louisiana Department of Health says 2 of the 3 kids that died in the past week were under the age of 5.
The rate of infection among kids under 5 was 3 times the rate in children between 5 and 17 years of age, and equivalent to the rate of infection among young and middle-aged adults, 18 to 49 years of age. So very young kids were hit very hard, and of course, they don't yet have the option of vaccination. We don't have an approved vaccine for children under 5 years of age.
He warns while our cases statewide continue to drop, we can't let our guard down or our masks, especially during the Mardi Gras break.
One of the things we've learned is that it's unpredictable and unrelenting. And so I don't think we've seen the end of COVID. It's not done with us yet. Most children who fall ill with COVID have mild disease. Most will recover and will not require hospitalization, and certainly will not die. But the risk is not zero. And so we've got to remain very vigilant and protect our children to the extent possible from this virus. And the best way to do that is through vaccination.
That was Caitlin Rust reporting. Dr. Kline recommends that everyone 5 and older get vaccinated. And if your children are under the age of 5 and not eligible, he stresses to make sure they are surrounded only with people who are vaccinated themselves.